Okay, so welcome everybody to the World Elder Abuse Awareness Day. And the title of today's webinar is Then, Now and Next, 20 Years of World Elder Abuse Awareness Day. So my name's Andrew Nicholas-Jones and I'm the chair of Hourglass. And I'd like to welcome everybody here today. Thank you so much for joining us as we celebrate 20 years of World Elder Abuse Awareness Day. And from now on, I'll be calling it WEAAD because it is quite a tongue twister. For anyone not familiar with Hourglass, we are the only UK-wide charity dedicated to ending the abuse, harm, exploitation, and neglect of older people. We do that across the 4 nations of the UK. We operate a 24-hour helpline with email, text, and instant message support available Monday to Friday, 9 AM to 5 PM. We also work to influence, lobby, and campaign to ensure older people remain visible in conversations about all forms of abuse. Today, we are going to be speaking to our colleagues at Hourglass from Frontline Services and our policy unit, and I will introduce them all to you in a few moments. For those viewing live, you will note that your camera and audio has been turned off. We do, however, encourage you to submit questions to the panel. So please submit these via the questions link. We will use these questions at the end of the seminar, and we will also be attempting to deal with any questions that remain unanswered in our next newsletter. I'd like to start by introducing Bethany Vague, our Information and Data Officer, who will be monitoring the question and chat facility throughout the session. I'm also joined by Molly Misen, our Digital Communications Officer, and Brian Johnston, our Safeguarding Training and Development Lead. Molly will be working behind the scenes today to ensure the webinar runs as smoothly as possible. If you are unexpectedly logged out of the session, please email Hourglass and Molly will do her best to resolve the issue. The email address for you to use is marketing@wearehourglass.org. But Molly will be putting it in the chat just in case anybody missed that address when I read it out. We are recording today, and this recording will be uploaded on our website. In addition to this, it is really important for us that we get your feedback, and we will be posting the link later for you to complete a feedback form. It's incredibly important for us that we get feedback on every event that we run to ensure that we are running events that people want to attend in the future. We'd also really love it if you could sign up for our newsletters, follow us on social media, and comment on our posts. So, to begin our conversation today, I want us to step back and look at how far the sector has come over the last 2 decades. So, WEAAD was launched by the International Network for the Prevention of Elder Abuse in 2006 and was recognised by the United Nations in 2011 to highlight the abuse of older people as a critical public health and human rights issue. When WEAAD was first recognised, the abuse of older people was barely visible in the public debate, and many of the protections we now rely upon simply did not exist. Understanding that history is essential if we're going to understand the progress made and the gaps that remain that we all need to urgently address. I'm now going to ask my panel members to introduce themselves. So I'll start with Maggie. So Maggie, if you could introduce yourself.
Hi, I'm Maggie Evans. I'm Director of Frontline Services here at Hourglass.
And Danny.
Hi everyone, I'm Dave Tatlow, the Research and Policy Officer here at Hourglass.
And Lizzie.
Good afternoon, everybody. My name's Elizabeth. I'm one of the team leads here at Hourglass, covering England and Wales.
And last but not least, Joseph.
Hi, I'm Joseph. I am External Affairs Lead for England and Wales at Hourglass.
Thank you so much. And as this whole conference, webinar is based around the history that we have around elder abuse, I'm going to start with our longest serving staff member, Maggie Evans. So I'd like to take you back to 2006, Maggie. What did it look like then when you first started working with what was Action for Elder Abuse?
Yep. So I've been here 22 years, and when I first became involved in the work in 2006, there was a key focus largely on abuse within care settings. Families were often the ones that we saw raising concerns, but there was very little specialist support and almost no dedicated focus on older people, unfortunately, experiencing harm across all areas of society. I think safeguarding for older people was still much developing. Many professionals had limited or no training or understanding about the unique risks that older people faced. When we go back then, we had no fixed set of safeguarding principles. We were working from guidance from No Secrets and working together, which set out ideas like protection, prevention, and partnership. But these were not formally listed or legally required. The focus was largely on identifying people, so older people, people as vulnerable, and following procedures to keep them safe, with rights and choice mentioned, but actually not placed firmly at the centre of the everyday work that we needed to do. Public awareness wasn't very good either at that time. We saw media coverage as well, which always used to show scandals in the care homes, in the hospitals, when actually what we were seeing as an organisation was behind closed doors. So it was a very different arena back then, much less protection than what we do have and what we're seeing now.
So despite the progress that we've made in this area, what do you think the biggest challenges are now still for frontline staff supporting older victim survivors?
I think while progress has been made, there's still a lot of work to do. We have awareness now, but older people continue to face these barriers to reporting abuse. Familial abuse remains under-recognised, despite being one of the most common forms that we see. Coercive control, there is still a lot to learn around this. We need to strengthen professional understanding and ensuring that all older victims are seen and heard and protected, and it must remain a priority across all the sectors.
Thank you, Maggie. Is there anything else you'd like to add?
I think, we still have that limited awareness. We still are not seeing that trauma-informed care that they deserve. And I do not think it is the practitioners on the ground's fault, which we often hear about. I think it's the fact that they don't have the training, they don't have the support, and we need to help them understand.
Thank you, Maggie. Can I move now to Danny? So Maggie's saying that awareness has improved, even though we've still obviously got a very long way to go. So you've been with the charity for almost 8 years now. How have things changed in respect of the data research we collect and produce from that date back in 2006?
Thanks, Andrea. Much like Maggie, I also joined the organisation when it was titled Action on Elder Abuse. And I remember our data, our helpline data, being stored on paper-based copies in filing cabinets in a small office in Streatham, South London. These days, the data we produce is far more all-encompassing, far more robust, and is curated and has been curated since I've been with the organisation through a number of very passionate staff members, Colin Scott, Elliot Hunter, and now Bethany Vake. We now utilise online CRM systems and cloud-based CRM systems to accurately input and analyse data collected from our really hard-working frontline officers. And basically, there's just far more awareness on the breadth of data that we need to analyze and collect these days. In 2006, there would have been no tech abuse or understandings of that. These days, we see tech abuse burgeoning. We see cases involving power of attorney and a rise in that, which sort of in 2006 would have not been the case. And we have a greater understanding of how perpetrators are linked to older victim survivors, and just a greater understanding and breadth of data that we collect these days compared to both when I joined the charity in 2018, 2019, and in 2006.
Thank you. So what do you think have been the biggest successes from your perspective?
I think that, just as I mentioned, our data that we collect is far more robust and strong than it used to be, and far more all-encompassing. We also create innovative policy and longer form research projects and papers which seek to raise awareness, which is incredibly necessary. It's probably the main issue that we deal with, is a lack of awareness of the abuse and violence that affects older victim survivors. We've just actually had a really recent success in that we've launched a collaborative PhD with Exeter University, which is going to be focused primarily on analysing our helpline data and seeing sort of what trends and avenues can be further pushed and seen through that. So that's a massive success and something that we couldn't have dreamed of back when I joined Action on Elder Abuse, and even further back in 2006.
Thank you. This is a bit more of a depth question around the analysis that you're doing. So what shifts have you seen in the types of cases being reported since 2006?
As Maggie said, we're seeing a lot more cases around familial abuse. Primarily, these will involve adult child to parent abuse, where adult children are the primary perpetrators. We are still seeing economic abuse as a plurality of our cases, which was generally similar back when I joined the organisation and back in the past as well. But as I noted, we are getting a far more greater understanding of more niche forms of abuse that we would not have collected back in 2018-19 and back in 2006. As I said, tech abuse, romance scams, power of attorney, predatory marriage, aspects that we didn't really or weren't on the agenda back in 2006 or 2018-19. And so we're really broadening the scope of the discussion through the data that we collect, and hoping to raise awareness and greater understanding and action from sort of policymakers through this data.
Yeah, it really is a clear demonstration of just how endemic the abuse of older people can be, and just how many different forms that it can take. So I'd like now to move on to a question for Lizzie. So since you started working with Hourglass, how have things changed in terms of the frontline practice and the support older victim survivors receive?
Thank you, Andrea. So yes, I mean, what's already been mentioned is that there is a greater understanding of abuse for older people, including that recognizing the breadth of how abuse can be used to target a victim, and that familial tech abuse and other forms of abuse that's just been mentioned. I myself feel like I'm very fortunate to have seen the development of the frontline services here in Hourglass, initially working within Pan Sussex with Sussex Police. We explored referral pathways and partnerships with local safeguarding hubs and GPs, community centres and domestic abuse services and charities who we still work with today. We then continue to grow our specialist casework across the 4 nations, where we have our independent domestic violence advocates, sexual violence advocates, and now older persons violence advocates. When we went national, we were providing that national advocacy service to those over 60 across England, Wales, Northern Ireland and Scotland. And we've seen that change in terms of the need for us to go all 4 nations, because people were reaching out to us in areas of the UK. They were asking for help, and we needed to be there to ensure that they were listened to and supported. And I think that support the individual will receive in our service is tailored, it's unique to their circumstances, and that's why it's really important that we are across all those 4 nations with advocacies representing those individuals, to ensure that those lived experiences of domestic abuse will be able to get those one-to-one support from somebody who can be local to them, understands their region or community, and I think that's the biggest step forward for us at this moment, is to make sure that we're everywhere to support within that frontline services. And it's really important that we're able to offer that to victim survivors, and that they can receive it when it's safe and it's manageable for them as well.
Thank you, Lizzie. So you've talked about how things have changed in terms of the breadth of support you're now able to offer. Has there been any improvements for older victim survivors? And if so, what, compared to when you first joined the organisation?
Well, that greater improvement on awareness that's been mentioned for older victim survivors, a positive increase in support services, recognising older people as being victims of domestic abuse, professionals using their curiosity to explore deeper into situations and circumstances which may have previously been overlooked or disregarded because of that individual's age. We are, however, still seeing barriers within the court system, for example, where older people are feeling uncomfortable to move forward with prosecutions. Courts may not be seen to be working in a trauma-informed way, which can pose a big barrier to an older person. They don't want to take the process forward, and at points when we are seeking special measures, this can be very difficult because there are nuances and the challenges, and the courts sometimes can't offer that or supply it. So that means they won't get the video link, separate waiting rooms, or entrance and exits. So the thought of going to court for an older person can be extremely terrifying, especially where it comes to an individual's child. As been mentioned, adult child to parental abuse is very common within our casework, and we are seeing the change within safeguarding and domestic abuse systems. However, that recognition of this familial abuse that's been mentioned, and it's still very, very low. There are many challenges to an older person reporting abuse from an adult child, and it's generally they don't want to criminalise their children, which is understandable. But then from my professional experience, they will seek to manage the abuse in their own homes, which means it's behind closed doors, and it kind of adds to that unseen nature of the domestic abuse. We still see challenges around tools that are used for older victims of domestic abuse, such as the DASH risk assessment, the domestic abuse, stalking and honour-based violence. It's not fit for purpose for older people, and it may not identify the correct support in place, and then they won't be able to be signposted on or get the safeguarding measures put in place. There is a positive side to some of the safeguarding being put in place, but we know that more must be done to identify and respond to the nuances of an older person so that they also have those equal rights and accessibility as another individual. So we will continue to work with those services to improve the safeguarding structures and policies for older people.
So based on that very comprehensive response, how has the helpline evolved since you joined the organisation, and what does that tell us about the needs of older people today?
I think the biggest development for our helpline since it launched in 1993 was that we went 24/7 in 2022, meaning that we could be available for those experiencing abuse, harm and exploitation every hour, every day of the year. And for those experiencing abuse, it's extremely important because they're able to reach out to our service when they are safe to do so. We know that they may be limited to the amount of time in the day which they can have access to a safe, accessible space to use a mobile phone or send a text message or go on our internet. So having that support line open and ready at any moment is vital. As many of you watching today may have seen on our socials, in just May of this year compared to May of last year, our phone calls increased by 34%. So the need is reflected in the statistics, which is why clear recording, data collection of older people is so vital. So it tells us where the need is for the older people and to ensure that they're seeking help and that we can be there to provide that. But we are really only seeing the tip of the iceberg here on our helpline.
Thank you. Now, last but not least, I'd like to move on to Joseph and the work that he's taking forward around building a safer ageing society free from abuse. So where do we still see major gaps in policy practice, research or service provision?
Thanks, Andrea. Well, I mean, it's supposed to be kind of talking a bit more about the positive side of the progress we've made, but given the opportunity to moan, I will have a moan about various things, some of which you'll have heard from our other panelists. But I think I'll go through. There's tons of gaps, but three big ones. I think the first major thing I can think of is that policy more generally and legislation, as in the laws we make, don't reflect the realities of abuse in later life. So most frameworks, strategies that you might see being released by the governments of the four nations are still developed around intimate partner abuse. They're still developed centrally around younger people. For example, the Violence Against Women and Girls strategy that the Westminster government brought out last December, finally, we've probably read it thousands of times now in our organisation, and still hoping for more mentions of older victim survivors. But it's very much centred around younger people, online harms, misogyny. I mean, these are all things that need to be tackled, but there just isn't any sort of real focus on older people. And as one of the sort of most unrecognised invisible groups, you'd have expected there to be more there. Similarly with guidance frameworks, which the government have been asking us to look at the moment. Just reading through them, and these are only from usually 5 or 6 years ago. They're still quite kind of out of date, all centered around, again, intimate partner abuse and younger people. Even the campaign you might have seen, which they're calling the Enough campaign, based off the back of this big forward strategy. It's all again centered around 18 to 24-year-olds, and will continue to be, despite all of our lobbying efforts. So there's a lot of work to be done there. And if we're looking outside of Westminster, Scotland's a really good example of this. The domestic abuse definition there completely excludes wider familial abuse. Powers of entry, not. I mean, it exists in other nations, but not in England. The fact is, many older people experience abuse from adult children, grandchildren, other family members, dependencies central to that. So you've got things like care, housing, finances, transport, medication, all sort of running into that. And none of this really features in any of the strategies that we're seeing today still. We're kind of forcing older people's experience into frameworks that are designed primarily for younger people. I realize I'm waffling here, so there are two more gaps I've still got to go through before the end of this question. Second gap we've talked about before, research and data. We still don't really know much about the abuse of older people. And that's because for years, older people were excluded from those data sets. As a lot of people know, the crime survey for England and Wales didn't count people over the age of 59 until either 2017 or 2018, I think. So we're still working on, other sectors have managed to kind of garner data through 50, 60 years. We're working off, barely 10 years of data here. And I think some of this is because some of the reasons for this is because the term like elder abuse, I know this is World Elder Abuse Awareness Day, is a bit kind of problematic. And some bits of research have supported this. It's kind of elder abuse has been bracketed off from domestic abuse, and it damaged kind of some of the academic work that's been going on. Older victim survivors are not kind of a separate category of victim. The same things that drive abuse earlier in life still drive them later in life. And it's not like elder abuse should be siloed off and dealt with like completely differently, really. I mean, it's much more complicated than that, but I think it has damaged research in this area. We've still got very limited understanding of sexual abuse in later life. We don't know much about perpetration. And the thing underpinning all this is we don't have the data. If we can't see what's happening, then we can't commission services. We can't tell commissioners what the problem is. So it's kind of, a massive issue that we talk about again and again. And finally, I would say probably, I think service design. So, for example, refuges, advocacy services, other support pathways, they're all still designed around younger populations. Older people may have, well, I think someone might correct me on the stat, but I think 79% of all people that come to our helpline, older victim survivors rather, have some sort of disability. They might have a mobility issue, caring responsibilities, or other health conditions. And they don't neatly fit into all of these frameworks that have been designed through services. Yeah, I think I'll stop there because I could go on, and I might run out of time. So yeah.
That's okay, Joe. I always like it when a decent shroud is waved around the issues. But based on that, I think very realistic portrayal of where we are. What new challenges and opportunities do you think have emerged as the sector has been developing? So maybe a few positives.
Okay, yeah, I can talk about some positives, at least, but I've forgotten the gap, and it's ageism, and that's really important.
Yeah.
So I'm going to talk about it really quickly. Um, so it's kind of the thread running through everything, right? There's assumptions that abuse that we see is a family dispute, or that economic exploitation or financial exploitation, however you want to say it, is inheritance related rather than abuse. Um, and assumptions that our frontline services see where confusion or fear or dependency is just part of the aging process. These are all sort of ageist assumptions, really, and that kind of it kind of underpins everything. So if we don't challenge that, then older people are still going to be overlooked. Um, okay, challenges and opportunities. I'll try not to repeat myself. The first challenge is demographic change. There will be 9 million more older people by 2050. That's populating the size of London. More older people means more people potentially exposed to abuse. Greater pressure on care systems. We still haven't sorted out social care in this country, which is ridiculous. There greater pressure on families and safeguarding structures as a result. So urgent work needs to happen on that. Technology, another challenge. Danny talked about this earlier. This is really new stuff. Online scams, romance fraud, coercive control using tech and other remote means, monitoring devices, the use of like apps, banking apps, and other ways that you can financially exploit people. Um, uh, Older people are actually increasingly online, but they don't often haven't grown up in a sort of digital environment that younger people have been exposed to throughout their lives. I think third challenge, I'd have to say complexity. There's a lot of reform going on at the moment across the whole of the landscape, really, whether it's healthcare, like the abolition of NHS England, local government reforms, policing reforms. So there's a lot of overlap between safeguarding, domestic abuse, capacity, um, housing insecurity, financial abuse. It's a very, very complex, multi-agency kind of era we're working in at the moment. So we don't really see cases that fit neatly in one box. We need involvement from everybody. Opportunities, greater professional awareness, I would say. So there are better safeguarding structures around us, better awareness of domestic abuse. There are more specialist roles coming up, like we have our OPTHA program at Hourglass. There's more willingness to discuss abuse than there was 20 years ago. So there is progress there. Health and financial services are a lot better than they were. Banks are a bit more helpful than they used to be. GP services are getting better at identifying abuse, not perfect, but there's good work going on there. And yeah, as other financial services are kind of getting a bit better. And these are places where older people tend to interact regularly, so it's good. So these are kind of, I guess, outside of more traditional safeguarding parts of the world, so it's good. And not to blow our own trumpet, I would say safer aging is the third opportunity. So we're kind of moving away from seeing abuse as isolated and towards more general kind of safer aging thought. So prevention, awareness, accessibility, housing, health, poverty, community connections, isolation, loneliness. So creating environments where abuse is less likely to occur, as well as tackling the abuse when it happens.
Thank you for the positive end to
Yeah.
your presentation here. I've now got some forward-looking questions that I'm going to put to each of you individually. So I'm going to go ask the question and then go around each of you to give me just one answer against each of these questions. So I'm going to start with Maggie. What do you think needs to change next to better protect elder people from abuse? Oh, Maggie, you're on mute.
I think better training has to be core. We need to get professionals on board We need to get them trained up to what we already know. We've been doing research now. We've been supporting older people for over 30 years as an organisation. There is the learning out there. We do have that knowledge. We should be sharing it more. We should be getting better training. But for that, we need better resources and funding. Without the resources and funding, the front lines, we can have these frameworks in place. We can have these policies and guidance, but without the funding and the resources, we are not giving the best support to older people in the UK. We really do need that. So I think there has to be a core on training on what we do and reviewing of the current frameworks and processes we have, because older people are missing from that. So there needs to be a key focus. So it's a two-way thing that we're looking at. And also I think around investigating. When we are investigating these cases, when we are looking at this, we need to look at the whole picture. And we need to be understanding the nuances of coercive control. It is very complex. There needs to be more work on this and more, like I said, training available.
Thank you. Who wants to go next? I'll go for a volunteer this time. Elizabeth.
Lovely, thank you. I think what's really important for us as IDVAs, ISVAs and OPVAs is to be recognised as professionals, especially when it comes to working with the courts, for example, and acting as an advocate for an individual, engaging with the courts, acting as that bridge to help them communicate with the CPS or the witness care team, having those barriers and not being shared that information and not being open with us when we are leading the victim through this process causes so many barriers, and again puts those worries and fears into the older person. So I think for us as trained professionals carrying our diplomas and our skills and our expertise, I think that needs to be recognised and on a wider scale, definitely.
Thank you. And who's next? Joseph, you've unmuted. Are you going to speak?
Yeah, but I mean, I kind of rambled about this for a bit in my previous answer, but just simply stop treating older people as kind of an afterthought. We need, like I said, better data, age-aware services, ensuring older people are actually considered in every conversation we're having about abuse. So yeah, it's not, and it's not just about responding to abuse. It's about creating conditions to make the abuse less likely to happen. I won't say any more than that because I think I covered most of this when I just spoke.
Thank you. Danny.
I mean, as you'd expect my answer to be, it's going to be around data. I mean, the last UK-wide prevalence study is almost 20 years old now, dating back to 2007. Although there have been strides in data collection in this area, obviously the removal of the age limit and the crime survey for England and Wales was a massive step. But there's still no collection of data for care homes or nursing homes within that data set. Police forces do not disaggregate data generally. It's very hard to get accessible criminal justice data concerning the abuse of older victim survivors or general sort of crime against older people in general. And these really make it hard for us to truly know the key nature of abuse of older people, the key trends, the key prevalence numbers. And without knowing that, it makes it so much harder to actually then stop this abuse happening or tailor measures and policies towards alleviating it.
Thank you. I think we've talked an awful lot about the concerns that we all have for the future, and the impact that our aging population is inevitably going to have. So I'm going to basically ask each of you to tell us what gives us hope about the direction of the sector and the future. Maggie, do you want me to pick on you again first?
That's fine. I do get hope from, like I said, the practitioners that are on the front line. They are driven. They do want to do their work. They do want to support older individuals. So that does give me hope. And it gives me hope that changes have happened over the past 20 years. They have been slow and they need to get at a quicker pace because the amount of cases that we are seeing. But I think having just that awareness has given me hope. We didn't have that awareness when I came into the organisation. We were only ever talking about abuse in care homes and hospitals. So it is slowly happening. We just need to drive this forward quicker.
And Lizzie, I'm going to come to you next. Thank you, Maggie.
So my hope for the future, Hourglass gives me hope. It's a cliche, but it does. The team that I work with, the people that are here, like Maggie said, on the front line, the people behind the scenes, the ones that are gathering the data, the ones that are feeding it back into the system. Hourglass gives me a lot of hope that we as a team and others that we can help raise awareness with and recognise the signs of abuse that will continue, and the snowball effect will just get bigger and bigger, and we will be able to help more people. And I hope that other people will take lead as well and follow what we're doing, and hopefully kind of replicate and take away some of the knowledge and skills that we've got, maybe some of our training, and put that into their own own kind of working policies and procedures. So yeah, Hourglass, what we do and what we're doing going forward gives me a lot of hope.
Joseph, a positive.
I think that most of the work I do involves speaking to politicians, and even a couple of years ago, it was a lot harder to kind of get through the door to talk about the abuse of older people. But now that we've kind of got a bit further along, really, it's a lot kind of easier to start persuading some of them that we need to talk more about the abuse of older people, and start kind of opening their eyes to the fact that this remains such a forgotten topic. So I think it's a really positive direction that some of those people are now kind of taking heed and listening. I just hope that that can then translate to some of the people we're speaking to getting into government and changing things properly. That's what I want to see.
Thank you. And last but not least, Danny.
I'd echo everyone's answer here, that sort of our colleagues at Hourglass give us huge hope. External people that I have the honor to collaborate with also give me huge hope, especially in the academic community, where we're seeing far more attention given to these issues, which is amazing. As Joseph said, there are a number of politicians who are really sort of much more aware and focused on trying to alleviate issues affecting older people. Shout out someone like Fabian Hamilton, who has done a lot of work around both predatory marriage and sort of trying to safeguard power of attorney, and also civil servants and those people behind the scenes that Joseph and I work with a lot, are passionate and driven and really trying to affect change for all victim survivors of abuse and violence. Obviously, we'd like to see more focus on older victim survivors, but that's there. The change is coming, and we just need to sort of push.
Thank you so much. I mean, that does really give us all, I think, not only hope for the future, but confidence that Hourglass really does have a handle on where we need to be going and where the focus of our work needs to be for the next 20 years of working to tackle elder abuse. I'm going to move now to bring in Bethany. Now, Bethany has been tasked with a mammoth job of monitoring the questions and answers that you've all been putting forward. So I'm going to hand over to Bethany and for the remainder of our session to actually put some of the questions from participants to the panel. So thank you, Bethany.
Thank you, Andrea, and thank you everyone for submitting your questions. There are a lot, so we'll get through as many as we can. If we don't get to yours, I'll be posting the inquiries inbox into the chat, so feel free to send an email over. So the first thing that's come up the most, I think, in the Q&A so far is around the dash. So initially, the first question was posed directly to you, Lizzie, actually. As an IDVA and DA trainer, what are the limitations of the dash in your opinion, and what kind of would you say needs to change?
Well, I mean, the dash is made for younger women and victims of domestic abuse. So in regards to the terminology and some of the questions that are in the dash, it doesn't suit the needs and the experiences of the older people that we support. So it's considering the wider kind of effects that may have to an older person. In the dash, it talks about children, and we often include grandchildren as well, because we know that grandchildren can be used as a bargaining tool for older people. So when we talk about the family, we make sure that we include the wider extended family and what that looks like for an older person, rather than keeping it quite narrow into the questions themselves. Some things can be quite triggering and quite upsetting for an older person. The one about have you been pregnant in the last 6 to 9 months, whenever that's just in some cases entirely not appropriate. So it's looking at and understanding how that individual will understand the terminology of what you're using when you're asking about abuse, physical abuse and non-fatal strangulation, for example. How that looked. Did they just place their hands on your neck? Exploring that in more detail and really digging down to the depths of what that person knows and experienced as their domestic abuse and what their circumstances are. Because we know that individuals that were married 40, 50, 60 years ago, domestic abuse wasn't seen the same as it is nowadays. So we're approaching it in a completely different way to how they would have thought domestic abuse is. So it's for them, it's actually making them aware that they have experienced abuse, whilst we're trying to go through and pick out all those nuances and challenges. So it's around that terminology, it's around how the questions are structured for the older person, and it's how that works within their understanding of domestic abuse. Maggie, did you have anything to add around the dash? I'm going to drop you in there.
Oh, are you on mute, Maggie?
This is something I'm currently exploring. I think it doesn't pick up enough of the key flags. We're having to use professional judgment a lot of the time. There's nothing around medication. Now, over medicating someone or under medicating someone can actually lead to a homicide. Why is this not being picked up on dash? There are multiple things that I see across dash that need to be added. The questions, as Lizzie was saying, the terminology we're using, it's not picking up key risks. So currently at Hourglass, we are looking at a practice paper at the moment on dash, and also how we can also look at using our professional judgment when going to Marek, what sort of things we should be saying, what we can pick up on. So I'm hoping very soon that I will have something to go out to individuals that might help practitioners on the ground. Think about some different questions when you're using a dash. What else could you be looking for? What other answers do you need to actually put that risk up? Because quite often when we see risk assessments coming in through dash, we re-risk assess and they are coming out much higher.
Well, thank you. The next question is also towards Frontline. It's around our OPVA project at the moment. So firstly, what is the Hourglass OPVA project? And secondly, if we know how many OPVAs there currently are in the country, and where they're located.
Unfortunately, we do not know how many OPVA, IDVAs or ISVAs are in the country. Specialising in older people, even less so. OPVAs have only recently been recognised in the MOJ guidance, which is an older person's, as we know, violence advocate. As far as I'm concerned, our staff were already OPVAs without that title. We have always been older person advocates. When we talk about the project here, the project is that every single one of our staff members will have that qualification. Rather than just calling themselves an OPVA, they will actually have the accredited accommodation. Accommodation is not the word, accredited, yeah. So all of our team here, when we talk about our team being IDVAs or OPVAs, they actually have the accredited training as well. So by the end of next year, every single one of our team members, we hope to be OPVAs. If they're not OPVAs, they will also have a diploma as well.
Great, thank you. Again, sorry, a lot of these are towards Frontline that have been coming through. So somebody has said they recall we've been developing alliances with a lot of other abuse or domestic abuse charities, and they just wondered whether this has impacted Hourglass's work, how it impacts our helpline, our casework, just what we've seen in the benefits of having those stronger alliances.
Is it me again? I think it's essential we work in partnership. These partnerships help us to share good practice. They help us learn from other organisations. We know there is a lot of specialist organisations that are dealing with all types of abuse. Yeah. And we can link in with them. We can share our good practice. We can come up with ideas for campaigns, project work. We work along, like we said, universities, so we can look at research. We want to work with partners. The more of us that are looking at this, it only can be better for the victims and survivors. We are not working against anybody at all in the communities. We want the communities to come forward. Statutory organisations, voluntary organisations, adult safeguarding, social workers. We want to work with everybody. The only thing we want to do is give the best support possible to the victims and survivors. That's what we exist for. We want to make a change. So those alliances have strengthened us because the more voices, the more impact. Yeah, we can all do our part. Yeah, we just need people to recognise it. We need people to speak up. We need people to want to work together, regardless of policies, frameworks, or anything else out there. We can make a difference working together. Yeah, it strengthens us. It strengthens the other organisation. We can share training with each other. Yeah, we can, give back that way by sharing training, sharing advice, building good referral pathways so that the victims they support and the victims we support get that best all-round advice and information.
Thank you, Maggie. So I do apologise that the Q&A has been very frontline focused. That was unfortunately our last question, but there are so many great questions in here. So I'd really urge everyone to please do make use of that inquiry email inbox and send over anything we haven't been able to get to. So thank you. I'll now hand back over to Andrea.
Thank you so much, Bethany. And a big thank you to all of you who've joined us today. And an even more resounding thank you to our panelists. So Lizzie, Danny, Joseph and Maggie. Can I also thank Bethany, Molly and Brian for bringing this whole event together for us. I think we all agree it's been a very interesting and I think informative event for all the participants. Before we close, could I just ask everybody who's attended today to complete our feedback form? Your feedback is absolutely critical for us in improving our future events. As well as the form that's available online now, we will send a link to you after the event by email. Please follow us on our social channels and sign up for our newsletter, annual conference and upcoming webinars. In fact, watch this space. We will be announcing our next webinar very soon. It's been a privilege to host this session as we mark 20 years of World Elder Abuse Awareness Day. I think we've looked back at where the sector began, reflected on the progress that we've made, and I think been very honest about the challenges that still remain, which are all of our responsibilities to tackle. The abuse of older people is better understood today, yet still too often overlooked. As our population continues to age, recognising and responding to abuse in later life must remain a priority for all of us and all services. Your work makes a real difference, and together we can build a safer ageing society. Thank you again for your time and your commitment. Could I just do a last reminder, please, please, please fill in our feedback forms. And if you have any questions that you want to ensure you get an answer to, then please do send them to the email address that Bethany has suggested. We can only tackle elder abuse by working together. This is something that as a society we owe to our older members of the population. And let's not forget, it should be all of our aspiration to join the older population at some point. So let's think about this as well, about setting up a society that we all want to age into and that we want to be made safe for the older people living in society today. So thank you very much. I hope you all have a good week and take the opportunity to reflect on some of the messages that we've given you today and reflect on how you can bring that into your practice now. And if there are any things that you would like to maybe work with us in the future to try and ensure that we are all working towards that safer ageing society, which is our aspiration. Thank you so much for attending. Okay.